Good morning. First, I'm Victor Dzau, the president of the Institute of Medicine, and it's my great pleasure to welcome all of you to this very important meeting. I understand that as of yesterday, we have over 700 people registered. We've limited the size here to 250 in order to be manageable in the breakouts and conversation. So a lot of people are going to be, in fact, on webcast. So we're seeing the devastating effect of the Ebola virus outside of the United States. Of course, we're seeing it enter the United States as well. Fortunately, the public health and health system response to the virus in the US has been robust. And of the small handful of people who had Ebola in the US, only one has died. Of course, in West Africa, the picture is very different. There, we have seen over thousands of cases and an alarming high fatality rate. Fortunately, we have just heard that the epidemic at Liberia may be slowing down, but we're still far from where we need to be. The CDC has predicted that in a worst-case scenario, over 1 million people could be affected by January in Liberia and Sierra Leone. Now, what went wrong in West Africa? Well, there are many, many lessons to be learned so that we can be better prepared in the future. Among these, in my opinion, is the need to step up efforts to improve health infrastructure globally. In fact, the IOM recently released a report on investing in global health systems, which make the case that strengthening health system is the future of global health. Jim Kim and Paul Farmer wrote a powerful op-ed illuminating this particular issue as a key factor in this crisis. Countries with weak public health and health system need greater assistance to manage and to contain this disease. But even in the US, we need to pay considerable attention to how we identify, treat individuals with the virus, and prevent its dissemination. The emergence of Ebola is a wake-up call of the importance of having a robust preparedness, public health, and hospital system. In addition, it is important to ensure that guidance and actions are based on up-to-date scientific evidence. Only then can we rest assured that we're doing our best for our patients, for the providers, and for our society. You know, there are still many scientific unknowns regarding Ebola virus, and we must put enormous effort into research that address them. For example, we need to learn more about viral transmission and methods of viral inactivation and disinfection of contaminated surfaces. We also need to understand how personal protective equipment can be best used by anyone who may be exposed to a virus, and not just health professionals. So there's a lot of lessons learned, and there will be lots of opportunity for all of us to have that conversation, discussion, and to move forward based on what we've learned. So the Office of the Assistant Secretary of Preparedness and Response, together with NIH and CDC, asked that IOM convene this workshop to provide rapid information about the scientific priorities stemming from the Ebola virus disease. The IOM is ideally suited for this because it's a trusted, independent, and unbiased space in which people can grapple and debate many of these topics openly. The HHS team has asked us to develop this workshop to inform them, the biomedical and public health communities, of the priority research that needs to be performed immediately to ensure that the current guidelines is based on the most current scientific evidence, to inform public health officials, healthcare providers, and the public with the most current information about transmission, health risk, and measures that should be taken to prevent the spread of Ebola. Furthermore, what research must be performed now before we lose access to important specimens or important information and data? Ultimately, we should aim for having a research system that allows us to collect and analyze data and to provide advice in real time. Dr. Lynn Goldman and Dr. Nicole Lurie will be addressing these objectives in a lot more detail next. So we're here to listen to various points of view, and we're looking to identify research needs and gaps. We're not here to provide protocol advice at this time, as that was not the intention of this workshop. We've opened this workshop up to the world through our webcast, so no matter where you are in West Africa or US, you can learn alongside with the participants. We actually have over 700 people registered to watch webcast today, and the videos will be posted on our website for future reference. I want to put up a slide to acknowledge the planning committee because they came together a very short time in order to do this, pull all this together. And head goes off to, of course, our chair, Lynn Goldman, but all the other people who reflected on this slide that I won't have time to read all the names. This is a workshop that's academies-wide, and therefore many parts of IOM and the National Research Council have come together to bring their expertise to this issue. I'd like to acknowledge IOM's boards of Health Sciences Policy, Global Health, Population Public Health Practice, and our NRC's board on Life Sciences of Division of Earth and Life Science Studies. Of course, I also thank so many of you who come from far and wide to present your research, viewpoints, and expert advice to inform the future direction of Ebola research in this country. Some of our invitees, unfortunately, were not able to make it because they are literally battling the epidemic even as we speak. And of course, our thoughts are with them today. So we have a full day ahead of us. We'll dive into several angles of Ebola: transmission routes, survival of the virus, protective equipments and behaviors, waste management, and disinfection methods. And at the end of the day, we'll discuss the urgency of researching each topic. So I think that this workshop is timely, important, and certainly exciting moment. We're advising on direction of research where government and our dollars should be spent. It's not a conversation to be taken lightly, and I invite all of you to bring your full energy and brain power to discussion. I'd like now to turn the meeting over to Dr. Lynn Goldman, who is the chair of this planning committee and this meeting, and she'll make some remarks. Thank you.